previous video, I had tackled about what is HIV, its history, and how it is transmitted. Now in this video, I will be talking about how will HIV be prevented. But before we start, let me introduce myself. I am Hitomi Ogasawara from BSN 1I. In this video, I will be talking about the second part of our advocacy video. I am not going to filter my words as much as possible because I believe that we should talk about this and not treat this as a taboo topic. Truth be told, it is occurring in the country, a lot of people have this, and viewing the issue as disgusting won't be of any help to anyone, especially to those that live with HIV. So first we have protect yourself during sexual intercourse. So how do we do this, you may ask? Well, by using condoms every time you have sex, you can protect yourself from having HIV. Condoms are highly effective in preventing HIV and other STDs or sexually transmitted diseases like gonorrhea and chlamydia. There is this external condoms that worn over the penis during sex and internal condoms that used in the vagina or anus. Second, take PrEP or the pre-exposure prophylaxis. It is a medicine people at risk for HIV take to prevent HIV. It is highly effective if taken as prescribed, but is less effective when it is not taken as prescribed. So the third one would be decide not to have sex. Not having sex, or also known as abstinence, is a 100% effective way to make sure that you won't have HIV or other STDs, and of course it can prevent pregnancies as well. Fourth would be to get tested or treated from other STDs. If you have other STDs, you are more likely to get HIV. Getting tested and treated for STDs can lower your chances of getting HIV. For the fifth one, if your partner has HIV, encourage your partner to get and stay in treatment. If your partner takes HIV medicine and gets and keeps an undetectable viral load, there is effectively no risk of you getting HIV from sex from your partner. Also, you can resort to activities with little to no risk of getting HIV, such as oral sex. But remember, you can still get other STDs from oral sex, such as gonorrhea, chlamydia, and syphilis. And lastly, for the prevention, never share needles, syringes, or any other drug injection equipment. Remember to always use new, clean syringes and injection equipment every time you inject to avoid transmission of diseases. However, if you do share needles, make sure that you use bleach to clean them. However, a disinfected syringe is not as good as a new one. So next, if you have HIV, the most important step is to get in care and take medications to treat HIV. HIV medicine called antiretroviral therapy or ART can reduce the amount of HIV in the blood, called the viral load. HIV medicine can make the viral load very low, so low that the test can detect it, called undetectable viral load. People with HIV who keep an undetectable viral load or stay virally suppressed can live long, healthy lives. Viral suppression is defined as having less than 200 copies of HIV per milliliter of blood. If a person has undetectable viral load, they have effectively no risk of transmitting HIV to their HIV-negative partner through sex. Also, it helps prevent transmission to others through sharing needles, syringes, or other injection equipment, and also from mother to daughter during pregnancy, birth, and breastfeeding. However, taking ART does not prevent transmission of other STDs. So now to conclude, there are many ways for us to be protected. We can use condoms, take PrEP, not share needles, or not have sex at all. And if we are at risk of having HIV or STDs, we can get tested, and you can also encourage your partner to get tested for HIV to help protect themselves and you as well. So that is all for this video, and I will be leaving the reference in the description box for easy access on the information. I hope you had learned something, and thank you for watching.